Every day, women walk into hospitals with a complaint that sounds ordinary. Lower abdominal pain, prolonged bleeding, or a strange swelling in their belly. But beneath these simple words often lies a silent intruder. Fibroid. A condition so common that some call it ordinary, yet so misunderstood that many quietly suffer until it changes the course of their lives. Fibroids, also known as leiomyomas, are non-cancerous growths that arise from the smooth muscle of the uterus, the womb that carries life. They can be as small as a seed or as large as a watermelon, growing silently within the uterine wall, beneath its inner lining, or on its outer surface. At the heart of fibroid formation lies a story of hormones and genetics. Under the influence of estrogen and progesterone, some muscle cells in the uterus begin to multiply abnormally. These cells cluster together, forming nodules that gradually enlarge over months or years. Fibroids are hormone-dependent. They thrive in the reproductive years and often shrink after menopause when hormone levels fall, and if your mother or sister had fibroids, your risk doubles. Reminder that our genes quietly shape our health. As fibroids grow, they compete for blood supply. When that supply becomes inadequate, the tissue begins to undergo changes, what doctors call degeneration. The most dramatic of these is red degeneration, where the fibroid bleeds internally, often during pregnancy, causing sudden, sharp abdominal pain and fever. Others undergo hyaline degeneration, where the tissue hardens. Cystic degeneration, where it softens and forms fluid-filled cavities, and occasionally calcific degeneration, where calcium is deposited, literally turning parts of the fibroid into stone. Each transformation tells a story of struggle, tissue fighting for survival within the confines of a womb. Fibroids do not always announce themselves. Some remain silent, discovered only during routine scans, but when they speak loudly, through heavy menstrual bleeding, prolonged periods, or bleeding between cycles. Many women describe a persistent heaviness in the lower abdomen, pressure on the bladder leading to frequent urination, constipation from bowel compression, and pain during intercourse. Over time, chronic blood loss leads to iron deficiency anemia, tiredness, pale skin, and dizziness become part of daily life. Certain factors make fibroids more likely: being of African descent, being between 30 and 50 years old, obesity, early onset of menstruation, and not having children. Studies also show a link with hypertension and diabetes, chronic illnesses that silently worsen blood flow and hormonal balance. The doctor may feel an enlarged, irregular womb through the lower abdomen, but confirmation comes from ultrasound, which reveals the size, number, and position of the fibroids. In complex cases, MRI helps map the womb in detail, while blood tests assess the level of anemia. If you ignore it, fibroids can lead to devastating complications: severe anemia from continuous blood loss, infertility, recurrent miscarriages, and pregnancy difficulties such as preterm labor or obstructed delivery. Large fibroids can press on the kidneys or bladder, causing back pain and urinary issues. In rare cases, the fibroid outgrows its blood supply and becomes infected, a painful and dangerous condition. Treatment is guided by symptoms, size, and a woman's desire for future pregnancy. For mild cases, medications like hormonal therapy or GnRH analogs help shrink the fibroid and control bleeding. For women who still wish to have children, a myomectomy, surgical removal of fibroids while preserving the womb, is often ideal. In severe or recurrent cases, especially after childbearing is complete, hysterectomy, removal of the uterus, may be the permanent solution. Newer options such as uterine artery embolization cut off blood supply to the fibroid, allowing it to shrink naturally. In the past, fibroids were seen as a curse or punishment for abortions or infidelity. Some believed they were babies refusing to be born. Others thought they were the result of spiritual attacks. Even today, many women first turn to local concoctions, agbo, and herbal steaming, hoping the fibroid will melt away. But these unregulated treatments often worsen bleeding, damage the womb, and delay life-saving medical care. Fibroids are not a curse, not witchcraft, not shame. They are a medical condition, common, treatable, and manageable. If you notice persistent bleeding, pelvic pain, or abdominal swelling, don't hide it, don't self-medicate, speak to a doctor. Early diagnosis saves lives, protects fertility, and restores dignity. As a doctor, I've seen women lose blood, womb, and hope because of delayed action. Let's change the narrative. Fibroid is not the end, it's a condition we can overcome together. If this message has enlightened you or someone you love, don't keep it to yourself. Click the like button, share this video with every woman who needs to hear it, and subscribe to this channel. Because here, we break myths, we spread truth, and we heal through knowledge.